Chapter 16 addresses issues encountered during the embalming process and specific issues related to uh, specific age groups. So other factors aside from age can affect the embalming process, like the size of the body, the weight, the cause of death, moisture conditions, postmortem changes, disease processes, and discoloration. There's a lot of intrinsic and extrinsic factors that go into how we treat a case. And so does age. The different age groups are infant to child, which would be birth to age 4, child to young adult would be age 4 to 12, young adult to adult would be age 12 to mid 70s, and then elderly would be mid 70s and older. Age can signal the embalmer to certain conditions. For example, positioning is generally difficult or different for the infant and child. It really goes back to funeral home policy and customs of the community that you're in. Setting features for the infant and for the elderly with a needle injector is difficult, sometimes impossible. So you'd have to know to do a mandibular or a musculature suture. The site for injection will differ depending on the age group and so on. Um, so this we were just talking about factors that influence how we do our case analysis, how we plan to treat the body, the different age groups. So for every decedent that comes into our care, there are factors determined when we do our case analysis or our embalming analysis. And this includes the vessels that we're going to use for injection and drainage. We know that the best site for injection and drainage is at the right carotid artery, the right internal jugular vein. This is the closest to our center of distribution, our center of drainage. Method of mouth closure. This is embalmer's preference, but a lot of embalmers that generally do needle injector for mouth closure. If you have an infant or a infant, a stillborn, elderly body where that tissue is too fragile, you'll have to address suturing. Strength of the embalming solution. This really has to do, strength of the embalming solution would differ in a delayed case, a refrigerated body, aka a delayed case. Anytime there's been a delay between the time of death and the time of embalming, you want to use a stronger solution. Age doesn't really factor when it comes to strength of the embalming solution because you have to learn for an infant, you still use the same strength as an adult. Wouldn't want to use a stronger solution because there is more moisture content in the infant body. However, you don't want to dehydrate the volume of embalming solution. This will differ for the infant. You'll use like a half gallon to a gallon. You wouldn't use more than that. For the adult, it's typically 3 to 4 gallons, but also goes back to size of the body, injection pressure, maybe like an elderly body. You don't want to raise your rate of flow because you don't want any swelling, but with an older body, you could address arteriosclerosis. So you want to cut your injection pressure up for that. And the rate of flow as well. You know, the ideal rate of flow is 1 gallon per 15 minutes. Typically, can adjust it, but you always want to make sure you don't get up too high because then it'll swell the neck. space to use. So the infant period is birth to 18 months. The toddler period is 18 to 48 months. Infant skin is much more delicate than adult skin, so it can easily distend and wrinkle from the injection of arterial fluid. The vessels are typically small, but should be free of sclerosis. Most infants are autopsied, but infants that die from birth defects or systemic diseases that was documented before they would need to be autopsied. So if there's more water content, you want to use a more hypertonic solution, but the caveat there, because you don't want to wrinkle the skin. But you want to make, you wouldn't do a dilute solution for the infant. If, however, the infant died from renal or liver failure, there's going to be a buildup of toxic waste. They have jaundice, for example, you can use a stronger solution. Because if they die from renal or liver failure, that toxic waste builds up in the blood, combined with the moisture content, it increases the demand for preservative, both to counteract secondary dilution going to occur, as well as the neutralization between ammonia and formaldehyde in the body. For an infant, you do not want to do a pre-injection. You don't want to put too much fluid in. You use a standard arterial strength, so 18 to 25 index, and you begin treatment with a topical disinfectant, wash and dry the body. Sorry, I'm just checking the slide. Begin with a topical disinfectant, wash and dry the body, the nasal and oral cavities, place the infant on a towel, and you can use the towel to help prop the head in position. When you're setting features for an infant, you want to cut the eye caps down. The eyes will be smaller, or use cotton. It's important that you use something because the eyes in everybody are going to flatten after that. So you want to have that natural contour. You want to glue the eyelids shut. You can wait till after injection, but make sure they're at least closed while you're injecting. For mouth closure, you use a muscular suture, which is where you pass the needle for the suture just in front of the mandible and that tissue, the lower lip, closer to the chin. And then you go up through the top of the mouth into the nostril, over, back down, and tie it. I'm sure I can find a video that shows y'all if y'all have done that. So depending on customs of the local community for positioning of the body, some funeral homes will keep the mouth slightly open, so it's like they're sleeping, or closed. Or positioning of the body, also due to local customs. Sometimes they'll position the arms in the sleeping position, different from the adult. They're not going to do the crossed hands. For embalming infant, my slides are not done with my notes. I apologize. You do want to use a smaller arterial tube, and you'll know that because when you want to raise vessels, it's not going to fit. So you'll have to use a smaller arterial tube. Now we're back with our notes. Let's see. Before embalming, topical disinfection, wash the body, clean the orifices, gentle manipulation, joints to relieve rigor mortis. If there's a intravenous tube, you want to leave it in place until after injection because it's inside of a vessel, so it can rupture it. If there's a tracheotomy tube or tubing nose or mouth, you do want to remove those before embalming, or they'll leave an injection. With the infant skin, because it's so delicate, you want to use thick emollient cream. The term you may see on your board, emollient means moisturizer. Those those lips in position so they don't dehydrate as well. And then after embalming, you can use wax to obtain natural line closure. Positioning the mouth for the infant, you have to be careful. You want it to look natural because that's the first that people look when they look at the body. It's the mouth. For positioning, this is customary depending on your community. Sometimes the arm is laid by the side. Sometimes they'll, and I've seen this, they'll hold a toy or a stuffed animal. They'll be positioned that way. Sometimes the head placed so that it rests on the side, like it's sleeping, like on the back, but head turned to the side. Blood vessel selections for the infant. You can use the common carotid artery and internal jugular vein. No one wants to embalm an infant. It's very emotionally difficult, especially if you have children of your own or nieces, nephews. It's very hard emotionally. And I have students, they'll text me. I had one the other day, a graduate text me. She was like, I don't think I can do this. Because I was like trying to tell her how to do it. And she wanted to do surface embalming. And I was like, well, I don't, I'm not your boss. I can't tell you what to do. And I was like, depending on what they want to do, you can use arterial system. If you're not sure if the surface embalming is gonna, work where you want it to. And I need to ask her what she ended up doing, but you can use the common carotid. This is the largest vessel along with the femoral. You turn the head opposite of the vessel that you're raising. Use a horizontal incision so that way when you suture it, it looks like a wrinkle in the skin. And that's where we go back to, we're going to do our suture lab when we can use like a worm suture for all that skin. It's just a natural fold over. Or you can do a hidden stitch and cover it with wax. So let's see. For the femoral or external iliac arteries, there are corresponding veins. These are the second largest vessels. When you inject the leg, and this is going to be an exam question when we have our when you inject from the leg, you always shoot the fluid distal first. So if you're at the leg, you inject towards the foot. That way you can see how that tissue takes it and adjust if you need to. So always inject the distal leg first, observe the effects of the solution, and then if necessary, adjust your solution. You can also use the abdominal aorta or the ascending aorta. However, it is extremely invasive. You wouldn't want to do this unless you're very experienced or you have someone very experienced with you. Technically, legally, you may want to get written permission, although I don't know how you'd ask family. Yeah, that would be like a.
Then you'd have to.
Yeah. And so that would be very tricky. It's not recommended for inexperienced embalmers because it's so invasive. You do the abdominal aorta, and y'all still have the old book, right? I've got the new book. I can scan it in. The new book has a color picture, but it does show you how to do it. When you do the abdominal aorta, make a 2 to 3 inch incision just left at the midline in the middle of the abdomen. So kind of like where you do your trocar, just go up and 2 to 3 inches. But then you have to open the greater omentum, which is, that apron of tissue that covers all of your intestines. And you have to look for the aorta, which is going to sit on top of the spine. So you have to move all the internal organs out or away to use the abdominal aorta. Now, if they've had an autopsy, then, if it wasn't cut or removed, you could use that. So once you locate the aorta, you open it, place the tube in the direction of the legs, inject still first. The vein is running right along it. It can be opened and drained right into the abdominal cavity. Of course, lower portion injected first and then the upper portion. If you're going to use the ascending aorta, you can take drainage from the right auricle of the right frame of the heart when you clip the right upper part of the heart. You can make an incision directly down the midline sternum, but then you have to use like I can't think of the name at the moment, the spacers to hold the cavity open while you're using it. And then you use a second U-shaped incision from one clavicle to the other clavicle.
It seems very.
It's extremely invasive. Yeah. I would never do this. Like it would have to be like this the very last resort, but even then you can still do surface embalming.
Yeah.
I'm sure there's very experienced people that can do stuff. But when you make that incision from clavicle to clavicle, you have to dissect the skin and pull the skin up. And then you can remove the sternum because it's cartilage, so you can cut it away. And then you open the pericardium, which is that sacral part, expose the great vessels of the heart. And the heart will be very small. The ascending aorta is coming out of the left ventricle of the heart, and the entire body can be embalmed from this point. Again, only specialized, experienced embalmers do this. Technically, legally, you would need explicit permission from the family, so that's a whole other ball game. And not recommended due to invasive. If you're going to use the common carotid, and for all of these, you'll use 18 to 25 index standard dilution to a half gallon to 3/4 of a gallon solution. So earlier I said 1 gallon, not necessarily, half to 3/4. For infant cavity treatment, standard treatment, you just use a smaller trocar. Sometimes you may have to re-aspirate because of that higher water content of the body. For the autopsy infant, my notes I went along with this. I don't have them full. It's all in your slides though, in back. Cavity embalming immediately. Probably you'd want to do it immediate so there's no breakdown. Although technically you could wait a couple hours after. Now we're at preparation of the autopsied infant. So for the areas not reached by arterial infection, they can be treated by hypodermic or surface embalming because with an autopsied infant, the vessels are been cut. So certain tissues are not going to be reached. There's different types of autopsies. There's a complete autopsy, which Mississippi's been doing a lot of those from what I hear. You may also see a partial, a special, or local. Let's say if they died something from the brain, and maybe just did a cranial. And also there are infant to an organ donors. For the autopsy infant, you say vessels of the adult. Don't worry about looking for a vein. Because drainage is going to go into the cavity. If you can't locate the arteries, you can use hypodermic treatment with a trocar.
We had a 3-month-old after New Year, and my preceptor like
I've done that, yeah.
It was really small, so there was the only option.
I had a stillborn. When I had that stillborn, I used a needle and syringe because they're so small. The autopsy infant, if possible, you would need just common carotids of external iliac. Sometimes you can find them if you look in the cavities. If not, surface and hypodermic embalming. If you're gonna use the arteries, you'll start with the femorals or the internal iliac, external iliacs. As you're injecting, pinch the fingertips and the lips to clear blood discolorations. Because the fingertips, sometimes they get a little blue. If swelling occurs, use a
No, that's cough.
oh, sorry.
So,
If swelling occurs, you can use a strong solution and less water. Because weaker solutions or diluted solutions are going to distend the tissue. When you're hypodermically injecting fluid, you don't want to use dye because it results in blotches of color or stain. When you're surface embalming an autopsied infant, or just if you were going to use surface methods anyways, you can paint the body with autopsy gel and then cover the body with a film of plastic and leave it for several hours, like up to 12 hours, how long it takes for the fumes of those chemicals to work. You can paint the inside of the cavities with autopsy gel. And if you have a premature infant, generally the easiest treatment for that is to hypodermically or surface embalm instead of trying to get the vessels. Autopsied infant after arterial injection, if you employ that hypodermic internal and external surface packs and preservative gels. When you have a premature infant, there may exist a need to preserve temporarily for funeral, burial, or cremation services. As we learned in the latest MFA conference, I think Kevin brought up, people are more willing, more commonly want more time, the time of death, funeral. And with it, then you have to take extra care for that. So for the premature baby, arterial injection can be attempted, but typically it's going to surface treatments. For embalming a 4 to 12-year-old, typically it is the same as the adult. Fluid strength and volume, 18 to 25 index. Typically the same procedure as the adult body. Slow injection used for drainage to help build up that pressure to reach the tissues. The major injection and drainage sites are the common carotid and internal jugular and the femoral artery vein. This age group is also usually autopsied, so sometimes sectional embalming or 6-point necessary. The abdominal aorta would not be used in this age group. Some embalmers will start with a milder solution in the first gallon, then strengthen the next inject gallon. You want to make sure you thoroughly aspirate, cavity embalm. Positioning generally the same as the adult, but some use more relaxed position, the arms by the sides like they're sleeping. With this age group, sometimes you'll see buck teeth. If they have buck teeth or dental problems, I think restorative art term you may see. You can place cotton over the lower teeth gum to help kind of push back the lower tissues forward. Some embalmers just lips slightly parted because people are used to seeing that. Embalming the adolescent and adult. This is our standard procedures, typically our routine. Ideal rate of flow 10 to 15 minutes per gallon. And then pressure setting 5 to 20 pounds. When you embalm the elderly, the potential difficulties are arthritic conditions, their hands in those closed fit. Yeah, they can be difficult to position. You'll also see atrophy of muscles because they've kind of wasted away in a nursing home, hospital setting. A lot of the time, the arms are drawn up to the chest, fingers clenched, especially if they were on bed rest. When you're embalming the elderly, the carotid's the best site for injection. But oh my gosh, Kayla had told me, so I want something like this. Because the femorals are likely going to be sclerotic. You don't have to worry about the final hand, right? But also position of the mouth could be well, because that tissue is degenerated. So you may need to do a mandibular and muscular suture. The mandibular suture is where you actually take the needle behind the mandible, go straight down through here, and then you place the needle back in that same hole and come around the front of the mandible. And then like with the musculature, I know, I wish I could like show y'all in person. Maybe I could find, I don't know if they could post it yet. No, maybe there's a county that other schools with more money. Oh, look. But yeah, you go behind out here, and when you place the needle back in the same hole, string doesn't show. So you can just do a drop of super glue right there, and then you come around the front, just like the musculature up to the nostril, back down. Let's see. The first time I did that was when I was embalming for another funeral. And because I was thinking about working there and they were like, well, come do a cake for us. And the first time I did that was with an elderly body. I could get the needle injector work. And I did that and he thought I knew what I was doing and I did. It worked. Good morning.
You didn't see? Sorry, I got you. Reese's. You need Reese's?
Oh, I did.
Okay, I got you, because I was like, well, she didn't text, so.
I just saw it.
Everybody can eat chocolate.
And I've got this recorded, so you'll see anything that. Talking about the different age groups, embalming different age groups. We talked about embalming infant and child, standard, young adult, and then now we're in elderly. With elderly bodies, you'll see arteriosclerosis, very common, most commonly in the femoral arteries. So the common carotid is rarely sclerotic, although it is possible, but because blood pressure is so high here, typically it's not going to be there. If that person had arteriosclerosis, you're going to have to expect poor circulation. Sometimes you'll see gangrene, which is where the feet are very dark, like black, because of the lack of blood flow. So if you see gangrene and it's still dry gangrene, hypodermically inject cavity fluid, cover it with a plastic garment. If there's wet gangrene, also hypodermically inject, but also surface embalm that area. It's going to break down very fast. Arteriosclerosis sometimes leads to ruptured aneurysms. This is a site for leakage during embalming, so you'll be losing some of your fluid.
What do you mean about gangrene?
So wet gangrene, it looks really nasty and it smells really bad, and typically it's on the feet. This is if wet gangrene is when there's a bacterial infection resulting from ischemic or dry gangrene. And you'll know it because it's just like open wound on the top of the foot.
Excuse me.
Sometimes
Yeah.
the bottom.
Verify emails.
Diabetics get them a lot.
Check yours.
That's why diabetics all like if they have it.
Black.
And also sometimes you have to get them amputated.
Yeah.
Not you, Mr. Hurt. You gotta take care of yourself.
I do have a few problems.
My uncle had his amputated here,
Yeah.
to take care of it, and they just had to keep chopping it off. He started off just down here and it just like,
I had to keep going.
he wouldn't take care of it.
They call
If,
them
if you're gonna cut it off, you might as well just hit me all the way at the hill.
Yeah,
He like, the tractor got
You're
on
not
it, it was
fixing to
up,
cut me off, unfortunately.
yeah, and he wouldn't take care of it, so they took off part of the foot, just has slowly gone up his leg.
oh.
It's not all, it's.
Yeah, they're
Well,
they're driving me a little. I'm trying to read that.
I'm not old. Well, here, let me verify mine.
Oh, you're, yeah, I
Yeah,
got
mine.
mine. Is Cole gonna be here today?
Probably not. It's not tested.
13.
They'll come at one of
Yes.
those, just like.
Where we going?
I may not be
Did you say May?
Big old.
I may or may not be coming for the relationship.
It's good.
It's been
Big old.
good.
Get the old.
And the JoJo's I being too, she the extra.
I love when they. extra.
Yeah,
Oh, what?
she gave me two JoJo.
What's the JoJo?
The fried
A
potato.
potato.
They're long.
I don't know what JoJo's.
It's a
Have we
potato.
had this conversation before? Yeah, it's gonna.
Some people don't know that they're called JoJo's.
I thought that, well,
Yeah,
Yeah, that's what some people call them. Box. I like a JoJo.
Yeah, it makes it taste.
must be like north, this, you know.
Mhm.
yeah.
Because one time there was somebody working at the gas station and I said, I'll get JoJo. And she was like that thing.
Yeah, yeah.
All right. With elderly bodies, you'll see senile purpura, which are those large purple patches on the arms, just the broken capillaries due to age. This is another form of ecchymosis, which is bruising. So it's extravascular. We can't remove it. It's a stain. We can lighten it. We can bleach it. It's just brought about by fragile capillaries due to long-term medications, blood thinners, vitamin deficiencies, skin, hypertension, and anemia. It does clear or during arterial injection. Sometimes it darkens and gets more intense purple. And sometimes because it's so thin, it can separate. So you might have slip. Also, sometimes it'll fill with fluid because fluid's going through the arterial system into the capillaries, and then those capillaries are broken. Sometimes they end up filling and swell during injection. So when you have someone with a senile purpura, if you're having issues with it, use a slow rate of flow, limit the rupture of capillaries, like surface packs of cavity fluid or phenol or gel on those areas. If the skin over those areas is torn or broken because of skin slip, you want to remove any kind of loose skin before embalming. When you're massaging the areas, you want to be careful because skin slip, the sleeve of the arm can come off if you're not careful. So be very gentle.
That's this feeling. It's always so cold.
Yeah. And with elderly bodies, you'll see a lot of people that die of cardiac disease. It's like one of the leading causes of death in America. So somebody dies from cardiac disease. There's a whole list of different kind of cardiac issues that they had. Common carotid artery and jugular vein, primary point. Use a moderate to a strong solution. If there's a local obstructions, like aneurysm, like an aortic rupture, an infarction, you may have sectional involved, you're losing too much fluid. If it's ruptured and can't get to other areas. Anytime we say sectional involvement, we're talking about 6 points, neck, arms, legs. If there's extensive edema to the face, somebody dies from a heart attack, it's generally like dark purple, face swollen. I've seen the tongue stick out in a lot of them. You can restricted cervical injection, which we inject both sides of the neck up at the same time. Sometimes people have on the table from surgery for cardiac disease. And they'll have surgery sutures that, so you want to hypodermically inject a cautery agent, which is undiluted, generally phenol or something. Drainage, if there's a pacemaker, might be difficult to suture. And also pacemakers go on the left side, right? Yes.
Take our little magnet. Cross it into.
Yeah, that's it. That's a.
They're typically on the left side. So if you see a pacemaker on the right side, oh, you're gonna have some because that means they couldn't, there's something wrong with the left side that they couldn't do it. So if the pacemaker is present, use the opposite side, which is generally the right side. But if it's on the right side, just go ahead and go. Might have some issue.
Well, I did that because we had a funeral a few weeks ago, or the visitation with the church, and pacemakers started going on.
Oh no.
That is the funniest thing. They just sit there. And
This son asked,
we had one kid one time.
he said, "Is he come back to life?"
Oh no.
So
Does anybody see it?
There for their little family.
yeah, she sent me back to the funeral with the magnet.
That's funny.
Because you know, when you wait on families, you don't answer that pacemaker.
No, not even.
No, they're not
Very.
cremated.
If they are to be cremated, move that pacemaker. That's a good idea to have a magnet. We did not have that. Um, but I know one time the garbage didn't pick up and it got off in the biohazard box. Taped up. You'll see diabetes mellitus a lot. This is both an acute and chronic metabolic disorder characterized by hyperglycemia resulting from deficiency of insulin. Principal manifestations of the most common signs of diabetes is hyperglycemia, hyposuria, this sugar in the urine, and ketosis, and the pathologic changes that occur. Maybe poor peripheral circulation due to arteriosclerosis, especially in the lower extremities, the most distal areas, which can result in gangrene, kidney failure, enlargement of the liver, and a lot of diabetes patients will get fungal infestations because they have lower immunity in the lung. So you want to make sure you thoroughly aspirate and cavity involved lungs. Generally, healthy people that aren't anemic, that aren't have lowered immunity, you're not going to get that. So you generally be safe, but you want to make sure you thoroughly aspirate just to be safe. For treating bodies with diabetes, you want to use a stronger solution. Want to add dyes as tracers. Common parotid is the best because the femoral is probably going to be sclerotic. They will recommend cervical injection, so you can use higher pressure shooting distal or down than you do up the face. And this helps your circulation. Hypodermic and surface treatment may need to be used if the lower extremities are too sclerotic. Massage the limb during injection to stimulate fluid distribution and make sure you disinfect the respiratory tract. That is chapter 16. Calming. I'm going to cut this off.